Here with Gwendolyn Thames and David Lehman to explain a little more about the protocols going forward as regards small business and a resource where you can go if you have any questions, because we're going to discuss a little bit May 20th, the metrics on how we got there and where we stand in terms of what we started discussing about 30 days ago with you. It's worth noting that tomorrow, I'm really pleased that two of our loosely aligned advisors on this, Scott Gottlieb, former head of the FDA under President Donald Trump, and Zeke Emanuel, who took a lead role at public health under President Barack Obama, will both be on tomorrow to give their thoughts about where Connecticut stands in terms of our response to the COVID crisis and what they see going forward. It gives you an idea of some of the expertise that we've been able to draw upon. And finally, Wednesday, May 20th, the final debriefing from Indra Nooyi and Dr. Albert Coe. And their role as the Reopen Connecticut Advisory Board will be coming to a close, but they've tried to be here every week, briefing legislators along the way, talking to many folks individually, and here to take questions from the press and you. So those are the first few days of this week with May 20th as our key point. As you can see from the daily summary, again, hospitalizations are down, tests performed are up. In the positive case, the percentage of those testing positive compared to those tested is below 10%. These are all part of the metrics, as you remember, for going back a few weeks ago now, were key to our May 20th date. Let's keep going here in terms of those criteria, Max. Number one, the criteria was a 14-day decline in hospitalizations. That was important in terms of capacity at our hospitals, probably number one. It hasn't been 14 days. It's been practically 4 weeks of declining hospitalizations. We're about 53% below peak. And one of the reasons I think that's important is we've been looking at the possibility of regional outbreaks. What we've seen around the country as they've slowly loosened up some of their protocols is the possibility of regional outbreaks. Fortunately, that has not been the case here. We're watching that, obviously, in congested neighborhoods, prisons, and nursing homes. Next up, increasing testing availability. That seemed a little ambitious, probably, when we said 42,000 tests a week, going back a few weeks ago now. We weren't even close to that number. But as you see now, we have achieved that number. We've done 45,000 tests in the last 7 days. So we have probably doubled our capacity in a week or so. And by the way, thanks to the good work of Kevin Lembo and the Comptroller's Office, we have secured laboratory capacity to double that capacity again by mid-June. And as Deirdre can point out to you, that allows us not just to test first responders, but test those symptomatic and asymptomatic, and allows us to do more broad-based testing going forward. A key metric, we've hit that metric. Next up is sufficient contact tracing capacity. And as Josh had said, what was important was we get this program up and operating before May 20th, and that we have done. We've got the Microsoft platform live, operational. We have a number of our health departments spread across the state now interfacing on that platform. This is important as we help roll this out, the local health departments around the state, staffing up with our own internal folks, lots of volunteers. I think I mentioned there's even a class at UConn on contact tracing. So we're going to do as much as we can with volunteers, as much as we can with our local health departments. I know we have enough capacity right now, assuming there's probably, one person per 12 COVID-infected folks that we can trace and grow from there. Next up, protect vulnerable populations. And this is so important, as I've said dozens of times. It's the right thing to do for these people, and it's the smart thing to do in terms of public health. As you know, we're out there testing across the board for our nursing homes and direct care workers. Correction staff, sort of interesting. The commissioner said today that we have done testing asymptomatic across a number of our correctional facilities, and we came up with about 28% folks that tested positive for COVID, 28%. Compare that to some of the correctional facilities in Ohio, which are at 80%. So I know this is a group that people have been focused on. I want you to know that Roland Cook and his team, I think at Corrections, have done a good job of getting folks who tested positive, get them quarantined off, and protect the rest of the population. You know, so far, so good. And finally, the at-risk urban communities. That's because these are folks due to some pre-existing conditions. These are folks who live in more congested areas. These are people that are most likely to get infected, more likely to suffer complications, more likely to have a flare-up. And Deirdre will describe in more detail what we're doing to build out our testing capacity into these communities. You heard about CVS, and they're opening up 12 new facilities. They are now up and operating. New facilities, additional facilities in urban areas in the southern part of the state to be announced very soon. Next up, adequate healthcare capacity. Different states look at this in different ways. Do you have 30% excess capacity? We've got a lot more than that. Josh and his team have thought that, look, we want to have 20% of beds occupied by COVID-19, less than 20%. We have found previously that we can make additional capacity available for COVID as needed if there was a flare-up. Look how fast our amazing hospitals did 6 weeks ago. But that said, I think we have about 11% of our beds right now with COVID-related patients, a number that's been going down for some time. And that, again, is our criteria, and we have met that. The adequate supply of PPE. We were there in the New Britain warehouse. I think you saw that we have a stockpile that's not 30 days of supply, but more like 60 days of supply. I think you know that it's more available. Supply and demand are matched. Businesses large and small are beginning to secure a lot more of their own PPE. I think maybe you know that FEMA is drop shipping today or tomorrow, I think, Deirdre, PPE to each and every one of our nursing homes to make sure not only do they have adequate gowns and masks, but they have a stockpile, they have an inventory going forward. In addition, we have bulk purchasing agreements that we'll be able to describe to you in a few minutes to allow businesses, large and small, to get the same low-cost pricing that we've been able to secure. You'll be able to get that. And by the way, we distributed 50,000 thermometers, over the last few days to businesses, large and small, to make sure they can provide at least an early detection for people going into the small business, the store, the big box, others, ways that you can, again, screen out and make sure that we keep you safe. Next up, appropriate workplace safeguards. There, I think Connecticut really has been a leader. Thanks to David Lehman, thanks to our Reopen Committee, thanks to working with restaurants, thanks to working with the Retail Association, thanks to working with many of you, we've come up with a more detailed, clearer set of protocols and graphics to give people a confidence that when they open, they know how to open, know how to keep their employees safe, and know how to keep customers safe. And if you want to open up successfully, you're going to have to give those customers and employees a real sense that you understand how important their health is. So those were our criteria going back probably a month or so. I think we've hit those criteria. I'm really proud of our team for what they've been able to do. Proud, especially in terms of testing, which was a big push. We've hit that hard. Proud in terms of PPE. We talked about that a lot. We have hit that mark and exceeded it. Proud in terms of getting that contact tracing up and operating. These were key things we wanted to do before May 20th. And that's why we think we're ready to do May 20th on a very safe way, a limited way, taking those baby steps, as Indra would say, but slowly get our economy moving again for each and every one of you. And with that, I'd like to introduce, I don't know whether Glenn or David, you'd like to take this, but announce a little bit what we're doing for our Small Business Reopening Resource Guide. Gwendolyn?
Sure. Thank you, Governor. Oh, I hear an echo. Can you hear me okay?
I think so.
Yes, we
Okay.
can.
All right, I'm sorry, I'm hearing an echo on my end. But again, thank you, Governor. We've been very focused on helping businesses navigate these very challenging times. And now that we're in the phase of reopening, we've published the rules. And so folks have a better understanding of what is required to comply and provide a safe and healthy environment for their employees and patrons. We are now focusing this effort on, okay, how do you actually do that? We know the what through the rules, but now how do you practically apply these rules to ensure a safe and healthy environment? And so today we've launched the Small Business Reopening Resource Guide. This was a collaborative effort through the Office of the Governor, Advanced CT, and our team at DECD, along with a host of community and business support organizations such as the Women's Business Development Council, the Small Business Development Resource Center, the Spanish American Merchants Association, HEDCO, many regional Chamber of Commerce, the Capital Region of Council of Governors, Lyle Ray, he has been the chair of this task force, so I just want to give him a huge shout out. A lot of effort went into this guide to, again, ensure that we're helping businesses navigate. A part of this guide that will be on our website, small businesses will be able to access a comprehensive list of financial resources. So outside of going to your traditional bank, there are other capital availability from our community financial institutions, CFIs. There are still several other loan products outside of PPP that the SBA through the CARES Act that are available. So there's a listing of those. So I encourage everybody to continue to take the look at those and evaluate those as we begin to reopen. In addition, there are resources relative to employee training and support. There are going to be new guidelines and a new rigor relative to keeping our businesses safe. And so this provides guidance on how to do that, how to get employees trained. In addition, physical layout solutions. So to the extent that you have to now think about social distancing in your work environment, this provides some support and solutions for that. And then most importantly is a list of geographic suppliers that have been vetted, some of which the state of Connecticut is using, and then that have also been vetted through businesses that have used these vendors and or Chamber of Commerce who have relationship with these vendors. So this is a vetted, secure list of suppliers for PPE, whether it's sanitizer, face shields, gowns, masks, or what have you, plexiglass partitions that are going to be required. You can find Connecticut suppliers as well as suppliers outside of Connecticut as a good starting point to start you up, if you will, because I realize it's been difficult for a lot of small businesses and the feedback that we've received and price gouging getting taken advantage of. So we wanted to provide a kind of vetted, safe list to get started for our small businesses. In addition, I just want to mention we will be launching in partnership with the Small Business Development Council, centers rather, a series of webinars that you'll be able to get further information on our website. But these are really opportunities to go into some level of detail relative to reopening and having best practices, having other restaurants, retailers that are doing really cool, innovative things to provide some role modeling for businesses to get active, to get ideas and kind of share peer networking and peer learning, if you will. So that's something that we'll be launching this week as well. So with that, I'll stop. Thank you.
Hey, thank you, Glenn. Now let me introduce to you somebody very busy, Deirdre Gifford, our Commissioner of Social Services and Acting Commissioner of Public Health.
Thank you, Governor. Good afternoon, everyone. So we just wanted to end with a few points about the approach from a public health perspective starting on May 20th. So we understand that it's been challenging to comply with all of these the strategies that the governor has put in place. So, but it's really important from a public health standpoint that we don't let our guard down. And the reason that it's important is because we don't want to see the infection rate start to climb again. So here are a couple things, just as reminders. We should be wearing our face masks or a cloth face covering at all times when we're in public. If you're outdoors and you can safely maintain a 6-foot distance from people that are in your vicinity, it's okay not to have the mask, but you should have your mask with you and continue to wear the mask, definitely indoors and when you're not able to keep a 6-foot distance from others. Again, the gathering sizes should be limited to a maximum of 5 people. That's to decrease the odds of transmission. And residents who are 65 or older, or those of you that have high risk factors, are encouraged to continue to stay at home as we have been doing over the last weeks. And all of these strategies are designed to prevent increases in infection. So it's very important that at the same time we're taking these measured steps that the governor has just described, that we're also keeping our guard up around preventing infection. That the infection is not gone. The virus is still with us, so we need to continue to take these important steps, which have really helped Connecticut bend the curve. It's helped our hospital systems. You've seen the number of hospitalized patients going down consistently, and that's because of all of the social distancing that we have, everyone, all of you have been so compliant with. So it's very important to keep our guard up after May 20th. Thanks, Governor.
Thanks, Deirdre. Any questions?
Channel 3 Eyewitness News.
Yes, Governor, we hit all of these 7 metrics. Looking forward to phase 2, though, will these metrics change, or will there more be added as we look forward to phase 2?
Yeah, what phase 2 will do is as follows. We're going to have a lot more of the contact tracing as we ramp that up dramatically. I think you saw that we're going to be doing a lot more testing in terms of asymptomatic testing, so we'll have an even broader universe. And frankly, we'll have another few weeks of observations of what's going on in this state, in this country. We've got places like Georgia and Oklahoma that have already opened up for a month now. But a month's a short period of time. We'll have a longer period of time in which we can analyze the effects. I think those will be some of the key things that we'll learn between now and the next reopening.
And one of the bigger headlines is the hair salons and barbershops waiting until early June. What were some of the obstacles that some of the owners were making you aware of that led to this decision?
Yeah. A couple of things. We looked at it from a pure health point of view. We had our committee say, these are ways that you could open up a salon. These are ways you could open up a barbershop. These are ways that you could do it safely. But in the last, week, a few days, 2 things happened. I would say, number one, I heard from a lot of the stylists. I heard from a lot of the folks that run the hair salons. And they said, give us a little more time. We're just not ready. We're not ready from, the employee point of view, feeling comfortable coming back, getting some of the cleaning agents and things they wanted. They wanted an extra, a week or 2. So we've said June 1st. And secondly, we had thought about May 20th because, Rhode Island, some of our neighboring states were talking about doing it about that time. And they are now going to push off another week or 2 as well from that May 20th date. So we can still work in collaboration with our regional states, at least Massachusetts and Rhode Island, and give our, hair salons and barbershops just a little more time. And look, I apologize because I know some of you were all set, ready to go on May 20th. Give us a little bit more time for all your peers to get up and operating, and make sure your employees feel confident and comfortable going back, if appropriate.
News 8.
Hi, Governor. This is Sabina with News 8. So touching on the pausing of the hair salons reopening, obviously we heard from a lot of hairstylists who were very happy with your decision, but we also heard from business owners, salon owners who are not happy with it. And I got a quote from a viewer here who I think sums up two of the main issues we've been hearing a lot of lately, which is the reopening as well as the unemployment issues. So our hairstylist says that she was spending money she didn't have so she could make some money this week so she could pay her bills. But now she's being told she can't. And she says she still can't get unemployment through the PUA system because she can't reach anybody at the Department of Labor to help her with her application. So I'd like you to comment on that.
Well, two things I'd say. One, for those self-employed, we are making those payments on a daily basis. But there are a number that were not filed appropriately. Those have taken a little bit longer. I apologize for that. In terms of May 20th and ready to go, we just heard overwhelmingly from a lot of the folks who work in these salons, they want a little more time. Child care was another big issue for many of them. Many are, moms, and they just said, we need a little more time to find a safe place for our child, and we said, we'll give you a little more time.
And as far as the timing of your decision, why wait until 2 days before reopening was set to begin?
Two things, like I said before. One, Rhode Island changed their direction. Massachusetts was, coming on board, I think, in about a week. And again, I listened. I mean, I was on the phone with a few hundred stylists just 5-6 days ago. And they were so thoughtful and responsible. They said they want to get back to work. I understand what it means, but we need a little more time. We don't feel comfortable, and we need a place for our kids. We said we'll give you a little more time.
Move along next to NBC Connecticut.
Good afternoon. A report out last week said that nationwide, 100,000 small businesses have been lost during the pandemic. Are you guys tracking that figure here in Connecticut? And if so, what is your estimate for our state?
Did you hear that question, David?
I did, yeah. Let me try to weigh in here. So I had not seen that report nationwide. We've not seen any reports and have not gotten good data yet on small businesses that have closed down here in the state. It's something we certainly will be tracking, and as we get data on it, we will report out.
Okay, and my second question is, both you, Governor, and Commissioner Lehman have talked about your hope of not having everyone rush out for the businesses reopen on Wednesday like they have in other states such as Wisconsin and Georgia. Our informal polls show that 73% of people are not comfortable with visiting restaurants outside right now. Are you content when you hear numbers like that, or are you concerned about the potential lack of consumer confidence in your reopening plan and the safety steps being taken?
My experience is, with the exception of bars and nightclubs, most people have been pretty cautious, even in places like Georgia that opened up broadly about a month ago. And my instinct is, and it'll be my personal instinct as well, that I will go back cautiously. I'll take a look at that outside eating facility. I'll see whether it looks like they're following the protocols. It looks like a place that I feel safe, and Andy and I would feel safe having dinner there together. So my hunch is you're going to have to earn the confidence of the consumers over a period of time. It will not happen overnight.
Yeah, I would just add on to that, Governor. We've done some polling ourselves, and the percentage you just put forth is consistent with what we've seen. And as the Governor mentioned, this takes time. I think it's going to take experiences at that retail shop, at that restaurant, to see what the new normal looks like in terms of hygiene and cleanliness. And I think you're going to see confidence build over the coming weeks and months.
Thank you both.
News 12 Connecticut. WTIC 1080 News.
Hi, Governor, you mentioned the Reopen Group is winding down. I know that Indra had said this is a process that's going to go on all year. So how is that going to play out with you transitioning to this group out of Boston, or how's that going to work?
No, what we've got is Deirdre and Josh and our team, our commissioners. We've gotten so many insights from the Reopen Advisory Board. They'll still be there as friends, but in terms of the day-to-day, they were putting in hundreds of hours a week. This was nonstop for them. Look where they came in the course of 30 short days. At the same time, as I've said, briefing legislators, doing the press and the such. So we're going to now focus more on what we're doing internally as we implement these protocols going forward. And you're right, we did hire BCG. They're going to be working for us as we figure out how best to implement these in a thoughtful way and how to coordinate with our regional neighbors.
The Associated Press.
Good afternoon, everyone. Governor, what would actually trigger the decision to maybe put the brakes on the plan to reopen? Are you looking at anything in particular, or right now is it pretty much a done deal?
No, I don't want to have to change direction, but if I saw that there was a spike in infections, I saw that there were flare-ups. As Deirdre said, we saw that people were getting more and more casual out there, and when it came to masks, when it came to distancing, and that was reflected in infections, that was reflected in hospitalizations. The number of COVID-related patients pushed up past 20%. Then we'd have to change gears. I don't think that's going to happen, not in Connecticut.
And on Friday, Department of Corrections came out with a news release that said that more than 100 prisoners at Osborne had tested, they had tested asymptomatic positive for COVID. And they were still waiting for a couple hundred more tests to come in. Do you have any update on that? And also, are you seeing a similar situation in other prisons?
Do either of you have any update on?
No, Hi, Paul Mounds here. The governor said in his earlier comments, based upon our unified command call, that DOC reported the 28% of those incarcerated that they tested positive asymptomatic was 20%, which is drastically lower than what we've seen in other states, including Ohio, which is at 80%. We're going to be constantly getting numbers on the day-to-day basis. Be happy to continuously update you. Roland Cook and his team, based upon those very numbers, have been working very diligently to protect not only those who are within our facilities, both as employees and workers, but also in those who are currently incarcerated, and will continue to do so.
I'm sorry, Paul, I lost my signal in the beginning. Have you received any test results from those outstanding tests?
The governor reported, based upon DOC's number, that 28% came back positive asymptomatic, which is drastically lower than our comparable states such as Ohio, which is at 80%.
So we'll get you additional numbers as soon as we hear them from those additional tests.
Okay, thank you.
Boceto Media.
Good afternoon. Governor Lamont, New York has proposed the American First Law, refusing bailouts for companies that don't rehire. Is Connecticut going to approve this proposal? And are there any other steps that the state will take in regard to employers taking advantage of some type of economic stimulus to not hire their workers back to the positions?
Yeah, let me start with that. It's the question of employers maybe taking advantage of employees, particularly employees of color, Hispanic, who don't have the necessary defenses. We're going to be very strict on that. We've got a 211 hotline. You can go there if you don't feel comfortable personally doing it. Just let us know the employers, those that are taking advantage. We want to make sure your rights are protected.
Okay, are you going to approve or considering to approve the emergency relief fund for those who didn't qualify for federal or state economic relief?
Do you want to take that, Paul? For those that aren't eligible, perhaps undocumented, for federal emergency relief or unemployment.
We have put forth various other programs, and what I'm going to do, I'm going to pass off to Deirdre, who can speak a little bit about that from the DSS and DPH perspective.
Yeah, so from the perspective of health care for individuals who may be impacted by a COVID infection and don't qualify for Husky or other benefits because of their immigration status, there is a coverage under something called emergency Medicaid for an individual to have the costs of their treatment or hospitalization covered. In addition to that, through the Unified Command, under Commissioner Lehman, there has been a lot of work to look at unmet needs of the undocumented populations and document those, and then get to work with local communities and other partners to develop strategies to meet some of those unmet needs. And those conversations are ongoing, and there's a lot of activity happening there.
Do you have any information of when you will have a decision about that conversation?
I'm sorry, I didn't hear the end of your question.
Do you have any information of when that decision will be made?
A date, let us get back to you on some specific dates when we might be able to make some announcements in that regard.
Thank you.
You're welcome.
Hearst, Connecticut Media.
Thanks, Max. Hi, Governor. I'm sorry if this is splitting hairs, but did you say June 1st is the target date for hair care companies and salons?
Yes.
Okay, thank you. And also, I was talking to some minority representatives in the hair care industry, and she was talking about a desperate need for some kind of financial relief for some of these black and brown businesses. Could I ask David to talk a little bit about that?
Sure, Ken, I just want to make sure I understand the question. What type of relief? This is in addition to some of the federal programs in the Connecticut Bridge loans?
Yeah, it doesn't seem like these might be underserved communities also. They might have bankability problems, if you know what I mean.
Understood. So obviously there's a couple things that we've been working on, one of which under Glenn Thames, Deputy Commissioner, has been the expansion of the HEDCO loan program from $2 million to $5 million. And that program exclusively focuses on minority and women-owned businesses in the state of Connecticut, in our cities, businesses up to 20 people, and they provide up to $20,000. So we're able to provide capital, and this is a loan which becomes a grant if the proceeds are spent in a way that is consistent with the program that is really meant to help these businesses in particular. And again, we've increased the size of that program from $2 million to $5 million. Happy to discuss more offline if there's still unmet needs out there and there's programs that we can create.
And when was it increased to $5 million, please?
I believe it was a week and a half ago, Glenn.
Yes, that's correct. And to date, as of late last week, 2 million had been approved, and over 150 companies started to get funded. So that program is full speed ahead, and companies are starting to get capital.
Thanks. And Governor, can you tell us what happened with your conversation with the tribes regarding reopening timelines and online wagering and such last week?
Yeah, we had our first conversation, and let's say it's an ongoing conversation, but I feel strongly, and my regional governors feel strongly, because I've talked to all of them, that it would be premature to open the casinos in the very near term.
How long was the meeting? Was there a full agenda discussed? Or, I mean, I guess online wagering would have to go maybe farther down the line. I don't know.
Yeah, that ended up not coming up in the conversation, but we had just a telephone conversation. Paul was there as well. The tribes were there. Obviously, they feel some urgency to get going, and our reopen committee and frankly the governors in the region just think that's not the right way to go right now, given the nature of the casino, indoors, older population, food and alcohol. Just time to wait a little longer.
Thank you.
CT News Junkie.
Thanks, Max. Governor, I wanted to know, we have 1,500 child care centers that are currently open in the state of Connecticut. I wanted to know what information we have about them, and are the staff being tested on a weekly basis?
Well, let me start on that, then Deirdre can save me. But we've got, unlike other states, we kept our daycare open. We have more capacity than many of them. We have 25% capacity right now, Beth Bai has explained to me. So that's very important. Again, for example, the folks at the salons who are very concerned about childcare if they were going to go back to work even on a part-time basis. So we've got that capacity right now. In terms of the testing, Deirdre, where are we on that?
Yeah, thank you. So first, I just wanted to say a note of thanks to all of the individuals who have been working in childcare over the past weeks and months. It's been so important for our frontline workers and our essential workers to have that capacity. So thank you for all of the work that you've been doing. Commissioner Bai, as you know, because I know she's spoken to you all, has done a really great job of working with DPH and with the providers around guidance for classroom size and sanitation and all those important guidelines. And we have not seen large numbers of cases in daycare centers of COVID. They do report to DPH, and it's been a very, very small number of cases that we have seen. So we are not in our first phase of high priority testing. The daycare workers are not specifically called out, but as we continue our reopening strategy and we continue to add to our testing capacity and our testing strategy, all types of frontline workers we will begin to develop guidance and recommendations for.
Do we have any idea, though, if children are carriers of this virus, or if they're better carriers of this virus? Do we have any information that's been shared with the Department of Public Health to kind of put together the pieces of that puzzle?
Not that I'm aware of. Obviously there has not been widespread testing of children, but in general we have not seen around the world that this has been a population that's been adversely impacted. And as you know, we've had very, very small numbers of cases of COVID infection in young children in Connecticut. And we're learning a lot more about COVID-19 infection. Every day we learn more information. And so, this is going to continue to evolve as, the scientists and researchers get busy better understanding transmission and who might be an asymptomatic carrier, et cetera.
And Governor, what happens if a barbershop or a salon opens before June 1st?
Don't open before June 1st. Those are the rules. And we'll be setting out some enforcement mechanisms in the next day or so, just to be clear about that.
Okay, but the stylists are allowed to go to somebody's home and collect unemployment, but also cut their hair at somebody's home, I guess?
I don't know. Somebody want to speak to that?
I'll jump in, Governor. I'll jump in. Christine, they shouldn't be doing that. So if they open before June 1st, they'd be in violation of the executive order from March that dictated essential businesses versus non-essential businesses.
Okay.
Yep. Hartford Current.
Hi, everybody. As testing has increased, do we have a sense of, has that testing mostly been the targeted nursing home prison population testing, or has the state begun to collect more samples at hospital locations? Because I understand that getting patients out to those locations initially was a problem.
Want to try that, Josh?
Yeah, it's been a combination of a number of different areas where we've seen significant increases in our testing. So the ones you mentioned, really all of those focus populations that the governor talked on earlier oriented around our strategy to protect the most vulnerable. So it's prisons, it's nursing homes, it's first responders, other congregate settings, and in particular our most vulnerable, heavily impacted urban communities as well, where there's been a tremendous increase in testing activity, both led by the state, led by some of our large healthcare providers. Hartford Healthcare has been very proactive about getting out into the communities in Hartford in particular to increase testing. And then generally also, I think the word is getting out about the need to go get tested if you've experienced any symptoms at all. We've really encouraged people, if you have any kind of fever, cough, diarrhea, shortness of breath, to really err on the side of caution and to go get tested. Or if you get contacted by someone doing contact tracing, become made aware that you've been in close contact with somebody who's tested positive to go get tested. And I think all of those messages and all of those strategies are building upon each other that have helped us achieve our goal to get to 45,000 tests in the last 7 days and to keep going from there into wave 2.
Mm-hmm. I also wanted to follow up on a question from earlier. As we move past May 20th, are there specific concrete numerical benchmarks that if the state falls below, you would start to roll back some of this reopening, just in the same way that there were benchmarks that allowed you to proceed with the reopening?
Yeah, and as the governor alluded to, this is all part of what we're going to be talking about on Wednesday with Dr. Ko and Indra Nooyi coming back, looking at our phase 2 goals, criteria, and potential rollback criteria as well.
One more thing for me. Is there any reason that you haven't released hospital admissions as a statistic as part of all of this, as opposed to total hospitalizations?
We've done that several times before. We could do it again. The data is a little noisy just because when someone comes into the hospital, oftentimes they're considered a PUI. So until they're tested and you find out if they're actually COVID positive or not, that data is a little noisy. But we've shared that data before. We can certainly do it again.
All right. Thank you.
Waterbury Republican American.
Thanks. Sorry about that. I have a question for Dr. Gifford. What is the expectation after we reopen? Other states are seeing increases in infections. What's the expectation here?
Are you asking what are we anticipating in terms of potential increases of infection in Connecticut? Is that your question?
Yes, after we reopen, when people start basically encountering each other, and probably some people may be asymptomatic, or maybe exposed to people who've had the disease. So I'm just wondering, is there any kind of forecast expectation?
Right. So we need to do everything that we can to prevent that from happening. And that's why the governor has outlined this very measured and slow reopening strategy. And it's why the testing that Josh just described is so important. The last slide in the governor's presentation was titled "Don't Let Our Guard Down," and I think that it's really important that we remain vigilant in terms of protecting one another from exposure to COVID-19. The virus is still present in our communities, so we need to continue to practice the social distancing, wearing the masks. I saw a statement the other day. Someone said, "My mask protects you and your mask protects me." And I think that's a very good way to think about the community effort to prevent increases of infection. We all have a role to play in keeping up with the social distancing, wearing our masks, washing our hands. All of those things don't change on May the 20th. So it's very important that as we begin to do this reopening, that the very complete and detailed guidance that Commissioner Layman, his team has laid out, it's going to be important to follow those things, because we don't want to see an increase of infection, and so keeping the guard up is really important.
Shouldn't it follow that there will be an increase in infections? I mean, it just as vigilant as we may be and as smoothly as things may go?
It doesn't necessarily follow, but some of that is in our hands. A lot of that is in our hands. So that's why the testing, continuing to follow the guidance is really important. You know, there are countries where we have seen a resurgence, and then there are countries around the world where they've been able to successfully keep the infection rate very low. And so we have some control over whether the infection comes back. One thing to keep in mind is as case numbers fall the chance of being exposed becomes lower. So it's really important that we continue to keep the social distancing and the other measures in place, because that'll continue to lower the overall infection rate in the community and lower everybody's chances of contracting the infection.
Okay, and this might be for David or the governor or Josh. Will businesses be allowed to refuse service to customers who don't have masks on? I realize the executive order has exceptions for people who can't wear a mask for medical reasons, but we're getting questions. Can businesses, or employees for that matter, refuse service to customers or patrons who refuse to wear a mask?
My feeling on that is yes. Unless you have a pre-existing reason that you cannot wear a mask, you should not be there to endanger somebody else by demanding service from somebody. So the answer is yes. You can deny them service.
And will that be in any guidelines that are presented to businesses?
I don't know, David.
It's not, but like the governor said, I think we view this the equivalent of no shirt, no shoes, no service for COVID here. No mask, no service, and that's up to the business, but that's what we'd recommend.
Okay, thank you very much.
Connecticut Mirror.
Let me follow up on what David just said to Paul. You saying it's up to the business whether they enforce the mask restriction?
No, Paz, what I'm saying is if the executive order that governs masks and social distancing is out there, that's for all people of the state of Connecticut. The question was for a specific business owner, they have the right to basically not let someone in their business if they're not wearing a mask.
Okay, but my understanding is it's more than that. They are under requirement not to permit people. Is that incorrect? That's been my understanding.
Well, so in the executive order, there are exceptions for people that cannot wear a mask because of medical reasons, and certainly very young children as well.
Sure.
So someone might feel they have a eligible medical reason not to wear a mask. We're giving the right to that store owner to refuse service to that individual, but that individual might still be complying with the EO.
All right, so that's that limited circumstance. Very good. I want to follow up on something I asked a while ago. Has the administration given any further thought as to whether or not you're going to issue guidance to people who will continue to seek unemployment after they have been called back to work, but because they believe they have a risk factor? Or are you just will this be a case-by-case evaluation based on existing regs, which have some broad language about the suitability of work and that health risk is a factor in suitability? Did you get that, Governor?
I got it. I'll start with it. Look, if you're over 65, you got a pre-existing condition. I have an executive order that says, you should not go to work. From my point of view, you should be eligible for unemployment compensation in a situation like that.
Okay, but you think that's clear enough and you're not going to put out any further guidance? Is that correct?
I think that's correct. I think it's clear enough, and DOL is interpreting it as such.
Okay. And then last question, on testing of these vulnerable populations and at nursing homes, I take it this is a dynamic situation. In other words, that the testing will continue at these homes. It's not like you're going to go through a home and try to test every employee and every resident. Or am I wrong? Is it the effort to have a list, go through that list of nursing homes and try to do a complete test, on any given day while you're there?
Yeah, you want me to take that, Josh?
Sure.
Okay. So we are right now, as we speak, performing what we're calling a point prevalence survey in nursing homes, and that is in fact a process by which we are testing every resident in every nursing home in Connecticut. And we're doing that for two reasons. One is to better understand the rate of infection among our nursing home residents, which we already know is high, but this will give us a completely accurate view. And the other, and equally, if not more important reason, is because we want these facilities to be what we call cohorting individuals who are COVID positive. And that will prevent the infection from spreading to individuals who are not COVID infected in that facility. So our facilities have been doing this right along, but with universal testing, they will be able to really even more implement this cohorting strategy, which will further decrease the chance of spread between infected and non-infected individuals.
Thank you.
You're welcome.
I'd only add to that our desire as well to test nursing home staff, ideally at the same time, and then on an ongoing basis as our lab capacity continues to expand. That's a population that we hope to test on a more repetitive basis. We are a little frustrated by how long it's taking to get the staff testing ramped up. There are some union-related issues that need to be resolved with the nursing home operators. We're doing everything we can to try to support that and push that along and stand ready to support that any way we can. But our goal is to have everybody in that nursing home tested at the same time for obvious reasons to support the cohorting that Deidre mentioned.
Well, wait, let me ask about the unions because you're going to get calls on this. What do you mean? Are you talking about requiring test of people? What is the union-related issues that you're speaking of?
Well, they have questions about where they'll be tested. Should they be compensated for the time it takes to be tested? There's different unions involved. They'd have different questions, different issues that want to get introduced into the same discussion. So we're just trying to push forward and get people tested as quickly as we can for the public health value of that and importance of that. And we are meeting multiple times a week to try to resolve whatever issues that remain.
Thank you.
The Day of New London.
Thank you. Sorry. As businesses reopen, there have been some concerns about larger crowds of people walking outside, passing close by each other on streets, and congregating in public areas. Does the state have any additional guidance on how communities should handle that aspect of the reopening?
Yeah, whether those stores are open or not, I think you're going to find with warm weather there are more people outside and there may be a little more congregating. And I know this makes it even tougher to stay socially distanced, but it doesn't mean it's any less important. And as I've said many a time, rather than us out there enforcing everything person by person, it's a lot better than you go up to a neighbor and say, please keep your distance. I think it's safer for you and it's safer for me and safer for your friends. And I say the same thing when it comes to stores that are crowded or whatever. And as you know, we also have the 211 hotline. So if you don't feel comfortable doing this yourself, give us a call and we'll enforce it for you.
Thank you.
Connecticut Public Media.
Well, we reached the 45,000 test mark you just said over the last 7 days, but you originally had said 42,000. Wondering, how did you come up with that figure of 42,000 tests per week in order to start reopening the state?
That was an analysis done in conjunction with our Reopen Advisory Group and some of the public health experts at DPH and others on our team to try to assess what it would take to not only dramatically broaden our testing of anyone with symptoms of COVID-19, but also to have enough capacity to begin testing those vulnerable populations that we've discussed a couple times on this call. So that was the goal that we set that would give us confidence to begin our phase 1 activities, and I'm really appreciative of all the hard work of a lot of people on the team that got that done.
And then over the weekend, I believe Saturday, there was 9,000 tests done. Is that a big spike? Is that an anomaly? Is there any reason behind that massive amount of tests being done?
I think in that one day, over the weekend, there was 8,800 or something. There was, some labs still report manually, and so the team at DPH has to, get caught up on certain groups. But generally, it will be a little lumpy from day to day as we're going out and blitzing some of these correctional facilities and nursing homes. So you'll see some lumpiness over time. But generally, the trend line, when you look at it, is moving in the very positive direction.
And the last question, when the task force is disbanded on Wednesday, will the Boston Consulting Group be running state policy on the pandemic? And how will the press and the public be able to know how they're arriving at the decisions they make?
We set policy. That's our job. Just like we set policy, we got some advice from the reopening committee. You know, me surrounded by some of the best advisors in the world, I think we made those policy decisions. And it's a judgment, as you know. And now when it comes more towards implementation, we're trying to get the best and the brightest to help us with the implementation. And that's why we thought the Boston Consulting Group, because they're doing this for other states, their ability to find best practices, their ability to help us coordinate with other states. But at the end of the day, it's Connecticut policy, and we make that policy.
Yeah, and Governor, can I just add, because I've seen in a couple articles over the weekend, there still seems to be some confusion on this point. Governments and large businesses hire consultants all the time to help analyze complex problems. This is routine in normal times, right? And we're in the midst of a once-in-a-lifetime public health and economic crisis right now. And I think the people of Connecticut expect us to move quickly and thoughtfully to protect their health and mitigate this financial damage. And most people I've spoken to are strongly supportive of us bringing in additional help from a top firm to support the governor's response efforts, just like other states have done, and to help ensure that we're moving at crisis speed. And that's what BCG is here to do, help.
Next to...
And in terms of the press or the public, how would we be able to know how they're arriving at the decisions they make? Will they join you in some of these?
They don't make decisions. The governor makes decisions. They help do analysis. They help do research. They help us synthesize feedback we're getting from various stakeholders. And they work with our commissioners to help bring that analysis together. And then our commissioners and our leadership team bring recommendations and analysis to the governor, and he makes the decisions.
BCG is not a state agency.
Fox 61.
Hi, Governor. Zania Maldonado, Fox 61. You mentioned enforcement mechanisms. With phase 1 reopening 2 days away, is there any update specifically on how these guidelines will be enforced on the state level, or will it continue to rely heavily on local city and town leaders to make sure people are complying come this Wednesday?
My understanding is there'll be an executive order that gives guidance to the municipalities on enforcing this. We'll be there to back them up. We've got state police, we've got others in the community, so we'll be there to stand up. And as I said before, we've got a hotline that allows us to act as a traffic cop, so we know where there may be folks that aren't following the key protocols going forward.
And many people are quick to understand aligning bars and restaurants and shopping with other nearby states in terms of reopening, but talk about why it was important to align the opening of hair salons and barbershops specifically with Rhode Island.
We made our own choice on that, but it did seem to me thoughtful that if we could do it in association, at least with Rhode Island and Massachusetts, it made some sense. We were both trying to prevent people driving back and forth across the border. I think your case is well taken. Unlike a bar where people may drive an extra 50 miles, perhaps a hair salon, people would be more circumspect before they do that driving. But we just thought it was appropriate if we could do it together. It made sense to do it. We were all pretty much within the same time zone, so we did it together.
I would just add, Governor, on that, if I may. With Rhode Island's opening plan, Connecticut is most similar to them. So retail for browsing, they've recently opened up. They're opening up, I believe, today, restaurants for outdoor service. And then their hair salons will be in early June alongside us. So we are very similar to them in terms of phase 1 or phase 1+2. And then recently, Massachusetts put out their plan, I think, this morning. And on hair salons, I think they're opening theirs up May 25th, so a week from today. So regionally, especially the eastern portion of our state, there's a lot of consistency on those points.
All right, sounds like that may be our questions. I got to thank each and every one of you folks answering these questions. I'll just say one thing. There'll be some protests back and forth on both sides of this debate. This evening, there may be a group called Hair Our Voice. And these were barbers and salon folks that said, maybe we're going just a little too fast. And we did hear your voice on this. Look, from a public health point of view, we felt very confident that what we were doing would not jeopardize your health, and more importantly, or just as importantly, not jeopardize the health of the greater community. But people needed a little bit of time, and we gave them some time to take care of some things that would make them feel even safer. And on the other side of the equation, I get a fair number of Liberate Connecticut protests driving around as well. And, you know, in one sense to me, it says you have the right to be as risk happy as you want to be, but not if it jeopardizes the greater good, not if it jeopardizes the public health. And I liked, Deirdre, you know, your comment about the mask that says your mask protects me. And I think you should remember that sentiment as we go through this next stage of a quiet reopening of our state. Let's get it right. Let's do it together. Thanks, everybody.